Our bones are responsible for keeping vital organs safe, along with numerous other functions. What can Filipinos do to prevent one of the most common diseases, weakening bone density, osteoporosis? Orthopedic surgeon Jj Pua joins us now on The Final Word. Doc, thank you so much for joining us. What basically leads to the weakening of our bones in our body?
Yes, for osteoporosis, no, it basically means that there is an abnormality with the microarchitecture and the mineralization of our bones. Meaning, most of it is calcium. It gets into abnormally low levels as we either grow older or other conditions that may cause it.
Explain to us, Doc, what is bone density?
Well, bone density is basically the mineral count, no? Or how hard the bone is. And basically, the bone is made up of calcium, which provides compressive strength to the bone. So if this gets into low levels, then you also affect the strength of the bone. That's why with osteoporosis, the main problem with this is that patients easily sustain fractures.
And apart from fractures, Doc, what else happens to a person who has osteoporosis?
Well, osteoporosis, aside from fractures, can also lead to decrease in height, because the most affected areas that sustain these types of fractures will either be the spine, the wrist, and the hip joints. So this can lead to a lot of problems, mobility problems apart from pain, and this can ultimately lead to problems with the health of the patient in terms of the patient's mortality.
And at which age usually, Doc JJ, which age period can there be signs of osteoporosis in an individual? Is it more prevalent in men or in women, or both?
Well, actually, no, that's a common misconception that osteoporosis is only seen in women because, well, one of the more common types of osteoporosis will be primary osteoporosis, which is related to changes in the hormonal levels of any individual. And this is strikingly very much apparent in women who are menopause already, because during menopause, estrogen levels now decrease, and estrogen is very important in bone metabolism. So yes, women mostly develop osteoporosis, but also men develop osteoporosis. In fact, the age that we can suggest the screening for osteoporosis for women will be 65 and above, but we can do this earlier at age 50 for both men and women who have risk factors for osteoporosis or those who sustain fractures in this age group.
And how do you manage then osteoporosis for men and women above 50 years old?
There is a whole program of management when it comes to dealing with osteoporosis, both non-pharmacologic and pharmacologic strategies. For your non-pharmacologic treatment, of course, there is the more important weight-bearing exercises. Then we have also diet that includes calcium and vitamin D, sun exposure. And then when a patient is diagnosed with osteoporosis, then that is the time that we also start with our anti-osteoporosis medications that are also available in the market.
So, is it too late to start now if you have osteoporosis issues? Can we start popping those pills into our mouth with vitamin D and calcium? Is it too late?
Well, of course, it's not really too late as long as we are able to screen and detect that the patient already has osteoporosis. Then we can start this and maintain this for quite some time, and then reassess the patient to see if there are improvements in bone density afterwards. So actually, osteoporosis is a symptomatic disease, because the only symptom that the patient might feel is when the patient develops a fracture or sustains a fracture already because of osteoporosis. And that will be probably be more cumbersome, more painful, no, more expensive for the patient to manage at this stage. No? So the best thing to do will always be to screen first and then to start with proper management
Right.
if your non-pharmacologic or pharmacologic treatment is needed already.
Thank you so much for this very important medical advice on osteoporosis, orthopedic surgeon Jj Pua. And you can get more health tips on MedTalk Health Talk, hosted by Dr. Freddy Gomez, with new episodes every Tuesday at 3:30 in the afternoon.